Okay, so I'd just like to introduce Renee McGregor. It's absolutely fantastic to have her presenting tonight. I'm really pleased. She's a leading sports dietitian specializing in eating disorders, female health, relative energy deficiency in sports, and particularly surrounding the female and male athletes and performance. And she's an author of 5 books now. So if you haven't read any of her books, go and have a look on Google and search for her, and it'll pop up with them. Okay. She's also done a podcast called Train Brave that I actually found a really interesting podcast to listen to. Great for car journeys. So if you have a look at that, Train Brave, I'm sure she'll mention it as well. So without further ado, I'm going to hand over to her and stop sharing my screen as well.
Thank you so much. Right, I will just crack on. If you have any questions, do pop them in the chat and I'll answer them at the end. But thank you so much for being here. I know how busy you guys are, so I really appreciate such a great turnout. Okay, so here we go. So today I'm going to talk a little bit about energy availability. And I guess it kind of, it introduces the topic of energy availability, and we then go on to kind of what happens when someone's in low energy availability, which I think is something that as sports medics, you will definitely see quite a lot of. And it's not quite as straightforward as people think. So hopefully we can answer some questions. But I think it's always important to kind of talk about what the role of performance nutrition is specifically. So you know, I think like people often talk about nutrition, and we know that nutrition has a very integral part to play in health and in performance, but performance nutrition in particular has some additional roles that I think often get missed, particularly in sort of just standard nutrition talk. So obviously the kind of the most obvious being having sufficient energy for optimal performance, and also preventing this kind of non-functional fatigue, because we know that a certain amount of fatigue is functional in that we know that it's kind of stressing the system out to a point which then allows for adaptation. But if it becomes something that is non-functional, that it's kind of constant, and an athlete is getting to the point of overreach and not getting sufficient recovery, then that becomes a problem, and something we have to definitely learn to manage. Another thing that I always kind of educate athletes on is this kind of consistent performance. I think in the world that we live in, there is so much information available, particularly on social media, and I think athletes feel a lot of pressure, particularly around kind of sponsorships and being able to create a profile for themselves. And I think that often the focus is on trying to achieve and get an outcome, rather than thinking about the consistency that they need in order to get progression and then see that outcome. And so I think particularly with younger athletes, it's about being able to encourage them to think about the bigger picture, think about the kind of wider aspect that, you know what, you might not get your best results in the first 5 years. We're looking at 10 years down the line, which can be very difficult when you're working with younger athletes who need that validation and want that need to prove that they're good enough. And then the final 2 points I think are the ones that I focus a lot of in my practice, is this prevention of stress to the immune system. So we know that, you know, timing of nutrition, we know that training load, not having sufficient nutrients, like certain nutrients, so things like vitamin D, things like probiotics, things like carbohydrate, hydration, all of these things are really critical when it comes to supporting and maintaining your immune system. And, you know, we'll talk a little bit more about this as we go through the talk. And then the area that I suppose is kind of my absolute sort of passion area is this kind of maintenance of normal hormonal and biochemical health, because I think hormones are often missed and ignored. And, you know, as medics, as consultants here, you will know that they are, again, central and kind of integral to pretty much every single biological function within the body. And so having a good regulated hormonal system is really critical. And this is where nutrition, and particularly energy availability, plays a really big part. So this is kind of the area that I, again, spend quite a lot of time educating, whether that's educating athletes, educating other health professionals, educating coaches as well. Because I think, again, you know, we live in a world where we're very much seen, the human body is very much seen as transactional, like energy in versus energy out. And that's how it's seen. And that's what people think about: calories in, calories out. That's it. And actually, when you start looking at athletes and particularly energy availability, this is the area that we need to focus more on. And so, yes, obviously we have energy requirements, and these are often broken down into sort of your basal metabolic rate, so which, as you guys will know, is sort of 60 to 70% of our total requirements, and includes also the amount of energy that we need for our brain to function, but also things like the thermic effect of food, so actually how much energy we use to actually digest the food we consume. And of course, then with athletes, we have this kind of energy cost of movement as well, which can be anything to up to 100 times more than what they need just generally. But what we never talk about is energy availability. And what this is the amount of energy that is needed to support biological function once the cost of movement has been subtracted from overall energy intake. So what do I mean by that? Fundamentally, the human body is hardwired to prioritize movement. So all energy that is consumed will be used for movement first. And when we're talking about movement, we're talking about training, obviously with athletes, but also general movement. So, you know, if they ride their bike to their training session, if they're walking around campus because they're a student athlete, if they have dogs and they're walking their dogs, all movement is included in this, and all energy is directed to movement first. It's how we have evolved as humans. And so then the energy that is left over is what we call energy available. And it's that energy that's available that is then left over to be used for biological function. If there's not enough energy to support biological function, and we're talking about obviously things like digestion, the brain, your heart, your hormones, your bone health, we're talking about your immune health. If there's not enough energy to support that, this is when the body then goes into low energy availability and starts to down-regulate biological function. And the bit that's quite tricky about this is that it isn't this simple, well, if you're not eating enough, you'll lose weight. Often, actually, the body, because of the way in which it down-regulates, will often hold on and preserve energy. And so actually weight might not change that much. We also have to remember that athletes often, their weight is slightly disguised because they will have a higher percentage of lean muscle mass, which means they actually will weigh more than what is really going on. So it's quite complicated. And the other thing that's really difficult about this is really hard to measure. So even if we were putting athletes into a lab and measuring their energy intake and energy output, again, that's not really mimicking real life. It's not really demonstrating, you know, it's not including the movement that they would do and the cost of eating necessarily that they would do. So it's very difficult to actually measure. And when we look at the science and the studies, we know that this value of energy availability will vary anywhere between 35 to 55 calories per kilogram of fat-free mass. And again, this is we don't know if this is the top limit. It could be much more than that, particularly in males. It could be higher. And what we've seen is that in very lean females, this number is much higher than 35 calories per kilogram. So this is the number that's often sort of put forward in studies, but actually we know that it can be very, very different. So if the number falls below 35 calories per kilogram of fat-free mass, then generally speaking, that means that there's going to be a down-regulation in biological function. So I think, again, you will know these facts, but we know that, you know, when you look at athletic populations versus non-athletic populations, there's a much higher prevalence of disordered eating and dysfunctional behavior generally. we also know that there's this kind of complexity around disordered eating and exercise addiction. So, you know, in the general active population, so we're not talking about athletes here, and just general kind of recreational athletes, if you want to call them that, there's actually, it's estimated that there might be a crossover like 40%. So 40% of individuals that will have disordered eating will probably also have an exercise addiction, which I think is quite significant. And again, similarly, we see that if someone is displaying characteristics of an eating disorder, they're also almost 4 times more likely to suffer from exercise addiction. So this is kind of what makes things quite complicated when you're working with athletes, is that often they'll have 2 extreme behaviors side by side, which can make it quite difficult to support them and help them change their behavior in order to then get them back to a place of resilience and robustness that means they can be, you know, able to perform in their sport. So I'm going to talk a little bit about REDS. I'm sure all of you will know REDS in terms of relative energy deficiency in sport, but I think what we're learning and what we're seeing, and also what I have seen, I mean, I have worked with hundreds and hundreds of athletes and individuals who have REDS, and you definitely see kind of slightly different things in practice to what is always put out in theory. But I think it's important to explain that REDS kind of falls on this continuum in terms of, you have accidental REDS, so unintentional REDS, which is very much exactly what it describes on the tin, in the sense that an athlete just accidentally falls into, you know, energy deficiency because they're just not aware of how much fuel they need, or how to fuel appropriately for the amount of training they're doing. Or perhaps, like we said earlier, they're commuting to their training sessions and they don't see the commute as something they have to worry about, but actually it's the swim, or it's the run, or it's the match that's the critical bit, but actually the cycle ride to the match they don't really care about. And so these individuals are very easy to work with, in the sense that they will often present with similar similar sort of symptoms, in terms of, usually it's recurrent injuries, or perhaps in female athletes they've noticed some changes to their menstrual cycle, or they're just not getting the benefits they think they should be getting from the amount of training they're doing, or even the fact they're just noticing that they're quite fatigued and not recovering very well between training sessions. But they'll often come to clinic and we can sort of do a full assessment, see where they're at, and often provide them with a nutrition and training intervention that means that within a few weeks, hopefully, sometimes months, that they can get their balance back and go back to their sport without any issues or concerns. However, what I see in practice is that a significant number of athletes who have REDS will have what we call intentional REDS, which is where they are consciously making the decision to reduce energy intake and or increase energy output, so increase their kind of physical activity. And this can be sort of, there's a very fine line between disordered eating and eating disorder, and a full-blown eating disorder. But again, if you to use the diagnostic criteria for eating disorder, not everybody's going to fit into that, so they then get sort of put into disordered eating. But one of the big things being that not everybody with a restrictive eating disorder will actually lose significant weight, and so might not necessarily come under, let's say, the anorexic spectrum, but actually will still have anorexic cognition, which is something that needs to be addressed and supported. So again, I'm sure you've all seen this, the kind of REDS cat that is used, and it's definitely something that we use as a guidance, but definitely I know a lot of consultants and sports medics will be using this. And I think it's a really good starting point, and definitely helps to get the athlete to find the right direction in which to go in. So I want to very, very briefly discuss what an eating disorder is. And I say briefly, I literally have one slide on it, because I think there's often a big misconception about what it is. And I think not necessarily in the medical world, but definitely in like the coaching world, and also in some of the sports science world as well. And I think it's often this common assumption that it's about the body and what we look like. And even if you listen to some of the stories of athletes who have come forward talking about their eating disorder, you know, that often kind of discuss the body composition, the body image aspect of it, which I find quite frustrating, because again, it demonstrates that they haven't really had the right support to understand what is going on for them. In reality, we know that an eating disorder is an emotional and physical illness with biological consequences that can affect anybody and everybody. So there's not like a particular demographic or social economic group that is going to be affected. It can affect anybody. I'll talk a little bit more about this in a second. And I think the best way I can describe it is that it's particularly restrictive eating disorders, but actually also binge purge eating disorders. It's a method of trying to avoid emotional drama. And it can also be a method of demonstrating the suffering the individual is feeling. So humans are hardwired to avoid discomfort. They're hardwired to avoid difficult emotions and difficult circumstances, and they don't cope very well in certain scenarios. And particular groups of individuals find this even harder. And often this is not like a conscious stream of thought. This is kind of a, you know, it's a blind chatter that's going on. It's something people talk about, this feeling, this extreme feeling of not feeling like something's right, this kind of dis-ease they feel within themselves, this feeling of not being good enough, of not being able to hit the criteria they need to hit, this very perfectionist mindset. And this is really uncomfortable for a lot of people. And so they will find means and ways of avoiding this discomfort. And often food avoidance, exercise dependency, these are the things that people will use, because these will temporarily support this process. It will temporarily help them to feel like they have got some sort of containment, some sort of control on a life that feels very messy and chaotic. So this, I think, is an important aspect of what we're working with in this field, is that you have this athlete mentality. So you have this kind of genetic predisposition. We know that a lot of athletes, probably also a lot of us here, have this very type A personality, you know, high achieving, perfectionist, compulsive, self-critical. And while these personality traits are useful, they're also, again, like sort of, you know, treading this very, very thin line, in that if they're not managed well, they can become dysfunctional. So you have this personality type, this susceptibility, and then you put that person who has a high susceptibility into the right social psychospace, and basically you've got the perfect storm to create these dysfunctional behaviors. And so we can't move away from societal ideals and societal pressure that is definitely very current in the Western world. And I know, like, a lot of individuals, even who have, you know, very, very kind of stable home environments and stable kind of work environments, will still feel this sense of unworthiness, of not feeling quite good enough. And this then generates this narrative, and they have to find means of trying to attain worth. And this could be through achievement. So whether that's through achievement of sporting success, or achievement through hitting a body composition. So this kind of pressure. And then we can't, you know, we can't ignore the fact that sports culture, sports environment definitely creates a very competitive space. And if athletes haven't learned how to manage this space, haven't learned how to manage their personality types, are unable to work through how to understand the kind of, you know, they're kind of constantly being exposed to the same sorts of language and the common themes that we hear in a lot of sports, then this creates the perfect storm for these dysfunctional behaviors to occur. And I feel this is really important for us to all understand, because this then helps you to help the athlete to know that it's not just about fixing the problem at its sort of on the surface, like, you know, okay, yes, you can give somebody a nutrition intervention, you can give somebody a training modification, but actually it's about getting them to also appreciate and understand the deep the underlying cause and how they can become much more self-aware to then support themselves moving forwards. So what happens in low energy availability? So, we're kind of here to talk about the importance of energy availability, but what happens when there isn't enough energy in the system? What happens when this sort of down regulation is going on? And as we said, it affects every single biological function in the body, every single kind of biological process in the body. So often we'll see athletes presenting with digestive issues, and this will very much sound like it's IBS. They'll talk about being bloated, they'll talk about being uncomfortable, probably increased gas and wind. And this is, in most cases, if somebody's in low energy availability, this is actually gastroparesis, so that slow motility of food through the gut. And also we know that when there's not enough energy in the system and there's extreme exercise behavior, this has a negative effect on the gut biome and actually causes dysbiosis. So the gut biome is no longer able to support immune health, is no longer able to support mental health, because the bacteria are not able to thrive and create that very varied microbiome that we want to encourage. We'll see this kind of down regulation in metabolism. And we know, like, again, if you look at physiological studies, it shows that if there is too big a deficit in terms of, energy input and energy output, all that happens is the body goes into compensatory behaviors. And this is also one of the reasons why actually often, obesity strategies don't work, because we are creating these very extreme deficits that actually physiologically puts that individual, sets them up to fail, because the compensatory behaviors will be this sort of down regulation in metabolism, so getting slower and slower and slower in order to preserve energy, because the body does not want to be hungry. The body does not want to be in low energy availability. The body wants to be able to function. It wants to be able to achieve energy balance, because again, that's what it's biologically biased to do, is to achieve energy balance. We get this endocrine dysregulation. So this is probably one of the more common things that you'll see and hear about, is obviously menstrual function changes, and eventually there could be loss. And so sometimes things we'll see, like menstrual cycle will get lighter, or there will be a tendency for them to become shorter cycles, which could suggest that there's, ovulation is not occurring, because again, there's not enough energy, particularly in the follicular phase of the menstrual cycle. That has a real impact on luteinizing hormone. Or the cycles get longer and further apart, or like we said, there's eventual loss. And we know that this is not okay and something that needs to be addressed. Similarly, in male athletes, we'll see a change to morning erectile function. So if this drops to below 5 a week, this could suggest that the individual is in low energy availability. Obviously, there are other reasons that can affect morning erectile function as well, but it is something to be mindful of. And definitely, I would be testing for testosterone at this point. If someone's mentioning this, then obviously, if testosterone levels are in single figures, then that's a big concern and something to definitely be addressing. Often athletes will talk about this kind of brain fog, and we know that estrogen and testosterone have been shown to be really important in production of serotonin and production of other neurotransmitters that help with our cognition. And so if these are down-regulated, then this would suggest that there's some cognitive dysfunction going on as well. Physiologically, we'll see sleep disturbances, because when a body is hungry, it can't sleep, because it's going to basically stay awake and is searching for food. Often there's poor adaptation from training. So, the individual will be doing loads and loads of training, and you'd expect to kind of see lean muscle mass gains or improvement in speed or force or power, and actually none of this is happening, because there just isn't enough energy to support those practices, to respond to those signals, and also to allow for the recovery that is needed in between to allow for adaptation to occur. We often see an increase in ligament and tendon injuries. So this is, I think a lot of people will associate bone stress and stress fractures with low energy availability and RED-S, but actually we see just a lot of ligament and tendon injuries as well, repeated, because again, the body hasn't got time to recover or respond, because there's not enough energy in the system. And then psychologically, obviously, when somebody has significantly, like when they're consciously making a decision to eat less than their body needs, then we know that has a direct effect on the brain and how the brain works, how the neurotransmitters are produced, and how they connect with each other. And if we were to look at brains on MRI scans, we would actually see big gaps in terms of the gray and white matter being affected. So structurally there is change, and we know that that then helps, that makes it more difficult for the frontal cortex to be able to evaluate threat, and also to basically think rationally. So we know that sort of that ability to think rationally disappears, and often a lot more of the brain, the part of the brain that's involved more is like the limbic brain, which is very much about feelings. And so the individual will talk about their feelings. I feel this so intensely that this must be real. And that's kind of, it's being able to help them to separate from their feelings and kind of show them evidence and facts, which is where being in the kind of medical profession can be really helpful, because you can provide them with data, so you can give them actual information based on blood test results and based on kind of numbers and assessments of bone health, etc. So it is really important that we provide them with information, because that can be very, very helpful in helping them to think about things in a different manner. So what we'll see often is this kind of physical decline. Like if you have somebody who's restrictive eating, has an exercise dependency, there obviously tends to be an increase in stress hormone. The stress hormone cortisol also actually uses up a lot of energy. So if this is elevated, it's actually also using some of the energy that is needed for health fundamentally. We also see a decrease in leptin levels. And so when we have this chronically high cortisol, this blocks our hypothalamic pituitary axis, which is why we start seeing this downregulation. And we know that actually low leptin impacts luteinizing hormone. And obviously luteinizing hormone is so important, particularly in female athletes, for ovulation and menstrual function. We also will see this on blood tests. So if you were to look at things like T4 and T3, you will see that they have downregulated. I'm not saying they're like super low and off the scale, but they'll be right at the bottom end of normal. And sometimes, I mean, I have seen T3 as low as sort of 1.8, which was quite shocking. But that's, you know, a significant low level, which is very much indicative that there's low energy availability, and particularly low carbohydrate availability. And of course, once you've got this picture, you get this overall downregulation of biological processes within the body. So the science has shown us that REDS is underpinned by low energy availability. So it's not, you know, REDS is multifaceted. Hypothalamic amenorrhea is multifaceted. Like many conditions that are associated with REDS are multifaceted. They're not just one thing. But something that I think is often missed is the amount of stress that the body has been put under. Stress being the physical stress of training, stress being the stress that is created through not eating sufficiently, potentially being underweight, but definitely not having enough energy in the system. Stress from the emotional stress, the anxiety of food becoming the focus, and the kind of the understanding of, not the understanding, the focus it takes and the energy it takes to be thinking about what to eat, when to eat it. And we know all of this starts to cause the autonomic nervous system to become, or it causes the nervous system to become stimulated and on alert. And the difficulty with this is that the individual will feel this as something's wrong, I'm anxious, something's not right. But because, again, about the way in which their brain works, they will find it very difficult to evaluate where this anxiety, this stress is coming from. And one of the things I find quite difficult, the work I do, is that, you know, when we're talking to athletes and saying, well, actually, we really need to modify your training, they will have this fear about losing fitness and this fear about, you know, kind of their mental health. And actually, it's trying to educate them to understand that, you know, if you already have a lot of stress in the system, adding another layer of high intensity stress through exercise is probably going to make the system a lot worse. And so sometimes it can be useful. The jury's out on this one, because we're not 100% sure if it's accurate in individuals that have low energy availability. But in athletes that I work with who have recovered, once they're in recovery and we know that their nervous system has generally kind of recalibrated and regulated, and their hormone systems have regulated, I will encourage them to use HRV, so heart rate variability, because this can be a good way for them to start to understand when their body might be feeling stressed. So for example, you know, in our female athletes whose menstrual cycles have returned, they'll often notice that around ovulation and then immediately before their period is due, their HRV is elevated quite significantly. So it can be an interesting tool, but again, it can be not the easiest thing to measure, because I'm not sure of the complete accuracy of sports watches, if I'm honest. So how do we go about diagnosing RED-S? I mean, again, you're probably very aware of this, but fundamentally, it has to be diagnosed by exclusion. So, you know, we do in our clinic, we do a full assessment of the physical status via blood. So we will look at some of, you know, the markers we've talked about. So things like thyroid function, things like cortisol, all the hormonal bloods, white cell count, vitamin D, iron status, because again, a very low iron could be the first indicator that somebody's in low energy availability, because if they have a low ferritin and a low hemoglobin, it would often suggest there's not quite enough energy in the body for them to produce enough red blood cells, or they're not taking enough iron in because their overall energy intake is very, very low. And so it could be an indicator. It could be something just to kind of as a red flag to be, if you see that, like maybe some additional questioning around nutrition and training and training load could be quite a useful kind of indicator. And again, we know that when athletes have a low ferritin level, this actually potentially has a higher risk of stress fractures. So again, something to be mindful of. And we will do, like I said, a full nutrition and training assessment. We'll also look at the weight and body composition history, because something I've seen a lot in practice is that often something changes when they move from junior level to senior level, or when they move from being a teenager they go into being kind of into, say, university. Training load will change, body composition will change, and this is where potentially it might not be, you know, an intentional thing, but actually understanding where their body has naturally sat before and where it is now and how rapid that change has been could be a reason for the low energy availability that we hear and see so much of. And then often we will also do like a psychological and behavioral assessment. So trying to understand the reasoning behind why they might be exercising quite so much. And often like the things I commonly hear are, you know, it helps them to earn their food. It makes them feel like they can eat what they want to eat. So these are things that we have to be listening out for, but also very, very mindful that are not healthy or helpful. So this, I think it's important to appreciate that, as we've said, not all unhealthy behaviors are going to be visible, in the sense that, you know, someone doesn't always look like they have a problem, you know, particularly if they are in red, or if they have like bulimia or binge eating disorder, or just a slightly dysfunctional relationship with exercise. Like, it's not always going to be physically visible. And so I think it can be quite useful just to have these questions, you know, just to hand, that if you're kind of concerned about someone, or you feel like, well, that your instinct is saying that something's not quite right here, these can be quite useful as additional questions just to throw in. I'm not saying you have to do all of them, but they can be really, really useful to understand where somebody's at. So I want to quickly talk a little bit about this concept of training low, because I think we've seen it a lot and we've heard it a lot in you know, in sport and in sport culture. And this training low is kind of like fasted training or training in a carb depleted state that often, again, coaches might encourage for adaptation, as they call it. And while there is some evidence that training low can result in adaptive responses, it really does need to be monitored, and it needs to be done really kind of restrictively, I should say. So we know that firstly, these sessions, if they happen, should only ever be kind of close to or just or below the first ventilatory threshold, so kind of a sort of conversational pace. And also they should never really be more than 60 minutes, and ideally they should never really be more than twice a week. The other thing training low does not mean is that you basically do not have carbohydrate and that your overall intake of carbohydrate is low. In fact, what we know, if you look at the science behind training low, actually ensuring you get good carbohydrate availability immediately after and then for the rest of the day, so you meet your carbohydrate requirements, is still really, really critical. And again, we've seen that when somebody is in chronically low carbohydrate intake, particularly for the amount of training they're doing, this will have a real negative consequence on their health and performance. So training low is something that we have to be aware of, because a lot of athletes will talk about it, but actually it's not necessarily how they've interpreted it. In addition, we've seen these links with low carbohydrate availability too. So in healthy women, in healthy weight women, we have seen that there is an impact on leptin production if there's not enough carbohydrate intake, particularly around the follicular phase of their menstrual cycle. And of course, this then affects luteinizing hormone. We also know that if there's not enough carbohydrate availability, particularly post-training, this can have a negative effect on bone activity post-training, when actually it can be quite heightened. We've seen that if there's not enough carbohydrate availability around training load, particularly like when athletes go off to camp and their training load might increase quite significantly, but their carbohydrate intake doesn't increase alongside, and that might be because of timing, because of schedule, not appreciating how much carbohydrate they need, then often we'll see this very depressed immune system, usually in the 2 weeks after, when they're more likely to get infections and illnesses, but also sometimes continuously for a long period of time. And we also see kind of if they're not taking sufficient amounts of kind of complex whole grain carbohydrates, then this has an impact on gut biome, leading to what we know is increased gut permeability. So often, like we see a lot in endurance athletes, where they'll say that, you know, they're going, every time they're training, they're basically having gastric distress, and that could be a sign that they've got this increased gut permeability because they're not eating sufficiently. And I know with a lot of athletes I've worked with, getting them to actually consume some energy before they go and train has made quite a big a positive impact on their gastric distress, but often they're too scared to, because they've already got, you know, stomach issues, and they're worried about eating, and that making it a lot worse. So how do we go about RED recovery? Well, you've probably picked up from my presentation so far that carbohydrate availability is really quite key. But what do I mean by that? So before I kind of talk about carbohydrate availability, I kind of wanted to put this slide up, but I want to put a caveat that this is not an absolute. This is kind of general guidance. It's kind of probably where I start with, and then depending on the kind of feedback and the monitoring will usually increase. But, you know, again, we've talked about energy availability and how it should never really drop below 35 calories per kilogram of fat-free mass, but this is probably much higher in lean athletes. And we know that, again, individuals that train a moderate intensity, so not high intensity, moderate intensity, their requirements are actually quite high. So if you think about the athletes you're working with and think about their training loads, you know, how much of that is moderate and how much of that is actually a lot more than moderate. And you can maybe start to understand why their energy availability is not quite being met. We know, again, that if they're training 1 to 3 hours a day, then their carbohydrate requirements will be somewhere between 5 and 7 grams per kilogram of body weight. And protein and fat, like these are minimum. I think, you know, these can potentially go up. They might be, these might be sort of on the lower end of what you want, but it's a good place to start, particularly if you are worried about energy availability and carbohydrate availability. If we increase fat and protein too much, that will displace the amount of carbohydrate they can consume. And obviously that still is quite critical. And the thing that we know makes a big difference is this kind of making sure that they are recovering within 30 minutes of completing their training. And I think I see this a lot. The two big things I see are fasted training and not recovering quickly enough after training. So this kind of nutrition is quite, so often we'll get athletes that will eat quite a lot at the end of the day, but actually the distribution through the day is poor, particularly around their training, and that's enough for their bodies to kind of start creating these higher cortisol levels and this general down regulation, and affect their performance and their recovery. So when we talk about carbohydrate availability, we are basically talking about ensuring that there's sufficient carbohydrate. We've already seen 5 to 7 grams per kilogram of body weight for 1 to 3 hours of training a day. That's quite a lot of carbohydrate, with carbohydrate being your bread, your pasta, your rice, your potatoes. It's not the fruit and vegetables that often we are sort of promoting in general population. Obviously in general population, where we are concerned about obesity and sedentary lifestyles, then we do encourage a lot more high fiber foods and high fiber diets, because this helps with satiety, but also can reduce your overall energy availability. But in athletes, we're talking about carbohydrate availability. We're actually talking about the complex carbohydrates that deliver energy, that provide the working muscles with the energy they need. And so it's about fundamentally ensuring that every meal and snack has a carbohydrate element to it, and that they are definitely topping up, particularly between their training sessions and in that recovery phase. When we're looking at protein requirements, we often talk about this sort of concept of protein pulsing. So this kind of idea that actually it's not just about the recovery phase, although that's important. It's actually about ensuring there's a good amount of protein going in at regular intervals throughout the day. And when we talk about recovery, as we said, it's about kind of this immediate recovery within 30 minutes. And sometimes this could be, you know, especially based on timing, this might be that this has to be like, you know, flavored milk and a banana, which kind of just starts that easily digestible intake of carbs and protein. And then that needs to be followed by a decent meal, which again has more carbohydrate and protein. Some examples of snacks, like if you have an athlete that comes in and you're worried about them and you know that they need to sort of fuel a little bit better, these could be kind of on your fingertips in terms of encouraging them to think about snacks they can have in their kit bag and that they can take with them. And then something that we sometimes have to think about and look at is training modification. And this is not something I tend to do necessarily alone. It will often be a conversation I'll also have with the coach. But obviously, depending on what you're presented with, if you have somebody who is a very high clinical risk, then of course you would have to stop all training. But equally, if you have somebody whose bloods are not too far off, then you can encourage, you know, training can continue, the volume might be okay, but actually you have to reduce the intensity. And I think there's a really good opportunity here to help an athlete understand the difference between sort of movement, exercise, and training. So obviously movement being what we need for our mental health, and that's kind of what we're hearing all the time. But I think people get confused and start thinking that they have to kind of do extreme exercise for their mental health. Exercise being kind of more participatory, like the kind of social connection, you know, something you do a few times a week to keep your general health balanced. And then obviously training being that kind of the training for a specific outcome. And obviously this also still needs to be periodized, and that's a really important thing. I often see that athletes don't tend to periodize as well as they should. So even on their off season, they'll still be. I remember I had a climber, a professional climber I was working with a few years ago, and she said, yeah, I climb really hard, I do all this, and then on my rest days I go for a run, and then on my off season I'm basically training for a half marathon, and I'm like, that's not periodization. But because they don't see it as their initial sport, they feel like they're periodizing. So it can be quite an interesting conversation, and again, you can learn quite a lot from it. So this kind of we've already sort of talked about, but I kind of like the idea of explaining how thoughts are created, because I think often, you know, athletes, individuals will talk about their thoughts and how they think something, and we know that thoughts are created through sort of the sound bites that are going on around us, and that'll be kind of the information that's there, whether that's from social media or our environments, societal ideals, whatever might be going on. And we know that these sound bites then, if they're sort of projected enough, these sound bites will become repeated thoughts, and then the kind of the neurochemistry in the brain will allow for these to become beliefs. So, you know, things like, I'm not good enough, I'm not working hard enough, you know, that person's getting better results than me, maybe I need to look like them, whatever it might be. And obviously these beliefs then become so incredibly real that they then create that kind of emotional drama we were talking about, that kind of emotional risk. And so then we get the behaviors that come into play that help them to avoid these kind of this physical feeling of discomfort. And this might be, you know, projection onto body image, perfectionism, exercise addiction, food restriction, alcohol, sex, drugs. It can be any of the above, or several of them. But I think, again, I always find when I'm working with athletes, helping them to understand their behaviors, helping them to understand the why, can be a really good way of then encouraging them to change how they think, and realize that they can respond to that thought, like look at the facts, what's the evidence, those sorts of things. So what makes good practice? I mean, from my point of view, working as a multidisciplinary team, so, you know, we always try and work with a physio or physical prep of some description, particularly if somebody's, you know, got recurrent injuries. We tend to work with psychology and some element of medical, whether that's sort of endocrine or sports medic. We'll always try and work, as well as the coach, you know, if the coach is willing to be involved. I think we have to think about the way we communicate, and we have to think about the language we all use. So one really good example of this is, if you do have an athlete that is low in weight, they're not talking about gaining weight, because that's almost creates fear, but actually talking about restoring weight, because it is about restoring. It's about restoring back to optimal, you know, restoring hormones. So it's about kind of the language that we use can be really important. And then obviously the kind of clinical and psychological monitoring. So we want to prevent this low energy availability. We want to get hormonal regulation. We want to help them to manage their perfectionism and their kind of very high standards that they tend to set themselves, and also their expectations, because these are the things that have a negative effect on their behavior. Kind of a final thing, but again, I'm pretty sure all of you will agree with me, you know, it's never okay for our female athletes not to have a period. Obviously, you know, hormonal contraception can be involved in this, and that obviously that can technically tend to impact whether they're having a menstrual cycle or not. But we know that, you know, the evidence is there. Female athletes need their periods in order, as a barometer of health, but also we know that if they're having enough energy to be able to have a menstrual cycle, then that would suggest they've got enough energy also to generate enough growth hormone to help them with their performance as well. So I always say that, you know, your menstrual cycle is a real indicator of health and not the opposite way around. But yet there are still female athletes that come to clinic who say, having a period to them suggests they're not working hard enough. And so this is something that we're starting to see change, but it's still out there. So definitely be mindful. I'm also seeing lots of female athletes who think being on the combined oral contraceptive pill means they're having a period. And then that again is a tick box. So again, being able to educate them and help them to understand that actually the contraceptive pill is not a period, it's a withdrawal bleed, is a big part of the work we all need to do. So just kind of final couple of slides then. I mean, in terms of road to recovery, as we said, it should be a multidisciplinary approach. It needs to be realistic, like we have to set some realistic goals that the athlete can actually achieve. So that's really sort of thinking about, sometimes I might not change the nutrition, but I'll just try and focus on the exercise dependency, because that's the bit that we can probably make most impact on. And if you try and do both together, you're setting them up to fail and it's too overwhelming. Obviously, the hormonal and biochemical regulation is needed, restoration of energy availability and or weight, if that's needed through nutritional counseling, a phased return back to movement, exercise, training, and that should be under supervision, regular monitoring of bloods, including the hormonal profile and bone health, challenging their food and limiting beliefs and these negative perceptions they have of themselves. That's the big part of it. And obviously, sometimes, as you will be aware, hormone replacement is going to be indicated in female athletes, particularly if they've had already one stress factor and their DEXA scan demonstrates significant bone loss, and their cycle has been lost for a significant amount of time. These individuals may well need to be thinking about HRT, also the transdermal version, in order to support their bone health, while they're also trying to support themselves and repair that energy availability. So just kind of, I think it's become quite clear, as you also know from being medical professionals, is that bodies are really complicated. I think they're amazing. I love understanding how the body works, and I love putting all the pieces of the puzzle together. But I think in the Western world that we live in, unfortunately, bodies are kind of almost fractured in that, if you do X, Y will happen, but actually not thinking about if you do X, actually a lot more might happen. There's a lot of things that work together. And so I think it's really important to kind of understand how all these processes work together intricately to be able to support someone when they're struggling. I'm going to stop sharing, but any questions you might have, if any of you are interested in knowing more about what we do, or have any athletes that you might want to potentially send our way because you feel they'd benefit, then these are kind of my contacts, and also my Instagram handle, because I actually put quite a lot of content and education on my Instagram. It's very much an education platform. So and also when I restart the podcast, all the information will be on there. So we mentioned the Train Brave podcast. There are 4 series of the Train Brave podcast, but I haven't recorded one for quite a while, just because I've been focusing more on my clinical work. But there's definitely a very keen interest to start the podcast again next year. So watch this space.
Hang on. I think she's muted herself. Okay. Yeah, if you can just remember to keep yourselves on mute. That was really great, Renee. I can't actually see your slides anymore.
No, I've stopped sharing.
All right. Okay, perfect. No, I think that's good. I just wanted to check. Okay. Okay, so I had a quick question actually, just based on a few patients that I've seen in sort of private clinic who maybe are not the elite athletes who have a lot of support around them, but maybe more an amateur individual that's got themselves into the problem of having essentially red S, and you've sort of diagnosed that with all your blood tests and things. And it's how much how much contact do you need to be giving these patients? Because what I was finding was actually I seem to be one of the only people, and you would try and sort of do recommendations and referrals to other professionals, but they didn't necessarily want to tell more people about the things that they were going through.
Yeah, it's an interesting one, isn't it? I mean, I think there's still a big stigma attached to having, fundamentally a mental illness. There's still a big stigma attached to that. There's still a big stigma. A lot of athletes, amateur athletes, might want their coaches and their team members to know what's going on for them, because it would show like a sign of weakness. So when we have individuals that work in clinic with us, it will vary depending on the severity of the individual and how much support they need. But I usually start with support every 2 weeks. And then as they start to kind of understand themselves and that kind of self-awareness around their behaviors and their personality type, then we can sort of start to extend that a bit more. But they do need a lot of support, and often they feel misunderstood. And I think hopefully I've provided you with enough information today that even going into your next consultation with someone with RED-S, you'll feel more kind of confident in asking some other questions and providing them with that support a little bit more. But it is, you know, some of them will need quite a lot of input, and they do find it difficult to talk about. And I still think it's something that people are fearful to talk about, because it might mean that they can't do what they want to do. Again, if we think about what it is, you know, if they want to run, let's use running as an example. If they want to run, telling someone that actually I'm having all these problems, they're always scared that you're going to say, well, you can't run. And they need that as their coping mechanism. So it's being able to kind of find ways to support them. And it's really difficult because often we do have to say to people, you can't run, particularly running, because running does seem to have a much more significant impact on the nervous system in terms of that stress layer, which prevents things from returning back to normal. It takes a lot longer for things to return back to normal if someone continues to run.
I mean, certainly what I've found is that, you know, with some cases you might say, you know, you can't run. And then the next week they've come back to me and said, well, I'm not running. But then they've told me that I'm walking to and from work, and it's, you know, 8K both ways. And so I did think that slide initially was really good about, you know, what are all the other things that they are doing that they don't class as exercise. Because that's a really important point. And we did have a couple of sort of questions, very scientific questions from Rupesh on the chat here. So low energy availability affects the cognitive function. So in that situation, are you recommending supplements like alpha GPC with the balanced diet? Or what, I guess in terms of supplements in general, what's your sort of view on that?
So I think definitely there are certain supplements that would be beneficial. I think the difficulty is we still don't really know if someone's in low energy availability, how much energy available is there for them to be able to use those supplements in the right way. So that's a question that I don't know the answer to. But I often start people off, if they've had a restrictive diet for quite a long time, I'll definitely start them off on some like B complex, because we know again that things like B1 and B6 and B12 can be very, very useful, especially around kind of anxiety and in terms of kind of producing some of the neurotransmitters in the brain. Omega-3, yes, we definitely talk about kind of like omega-3 and encouraging a good balance of DPA and EPA, kind of DHA and EPA, so that they're getting what they need from that point of view. But again, I'd prefer them to get it through their diet if they can. I mean, always, as a dietitian, I'm always food first, like that is how I am. But there are definitely certain nutrients that we would be encouraging. Vitamin D, obviously, for various reasons, and you know, I think a lot of us will be recommending. I think one of the ones that's quite interesting is I often see athletes that come to me who've been told by their GPs to take vitamin D and calcium if their bone density is low or they've had repeated stress fractures. And the thing I would say about that is that we know that to get absorption of that vitamin D and absorption of that calcium, you do need to have that IGF, you know, you do need that growth hormone, you do need that estrogen. And so yes, it could be an insurance policy in terms of like you can recommend that, but actually again, you'd be better off trying to encourage their energy availability and trying to get that through real food. I'm saying vitamin D, you can't, but you know, through real food. And kind of to go on to his second question about the role of fat. I mean, again, fat is really important to absorb your fat soluble vitamins. I mean, if you don't have fat in your diet, you're not going to absorb your vitamin A, D, E, K. You know, these are really relevant. But also fat is also important in the production of hormones. So, you know, yes, you need that overall energy, and yes, you need the carbohydrate, but actually you also need fat in the diet too. And often fat is still a fear food. So again, trying to get them to take on foods that they are fearful of, to help them to break down that belief is a big part of it as well.
Can I ask a question around the calcium? Because I'd had one direct message to me just about absorption of non-dairy type calcium, you know, with maybe lots of people being on vegan diets.
Yeah.
Is there a difference? Are the ones that are better absorbed than others?
Yeah, I mean, again, trying to encourage people to take foods that are naturally higher in calcium through a plant-based diet is going to be better. So things like your tofu, you know, edamame bean, soya-based products are naturally higher in calcium. So those can definitely provide a sufficient amount of calcium if taken in the right quantity. Where, again, we're still unsure is a lot of the plant-based milks do have now calcium added to them, but we don't know how much that you'd absorb. But equally, the thing to remember about plant-based milk as well is they don't have iodine, and that is very, very important for obviously metabolism and thyroid function. So a plant-based diet is a complicated one. It's definitely not my favorite one when I'm working in this group of individuals, but it's definitely the one I see the most of. And it's about, what I find is that actually starting softly and kind of encourage them to try and move away from almond and use soya instead is often a good way. And what I find is that, generally speaking, as they return, as their health returns, they will often say, do you think it'd be a good idea for me to include eggs? Do you think I should maybe be having a bit more animal fat in my diet? You know, again, often they've gone plant-based because it provide them with a legitimate reason to avoid certain foods. And as they start returning to health, often they'll question why they've done that. And I'm not saying that's always the case, but often they will. So I think you have to be mindful, and in that situation, probably providing a calcium supplement is a good idea as a kind of backup. But I think we just don't know how much is actually absorbed, and so it's one of those things that you have to be aware of.
Okay, and then can I just go to Farah, because Farah, I think you had a question. It said it related to NHS dietitian services.
Yes, I do. Thanks, Renee, for a very informative talk. I work both in the private sector and also in an NHS sports medicine clinic, and of course we do see patients in the NHS who are affected by relative energy deficiency, and I feel like they're in a bit of a no man's land from the dietitian input aspect of things, because I think many of them may not fit NHS referral criteria to a dietitian based on my understanding of, you know, the NHS referral criteria to a dietitian. Is this topic, do you think it is sort of filtering down to NHS dietitian training, or, you know, is this something that they're all familiar with, or is it just not really their realm? You know, what can we do with those patients? What can we offer them?
Okay, so I mean, so fundamentally, a bit like medicine, as a dietitian, you don't get any training in sports nutrition at all. You're very much clinical dietitian, and that's what you learn to do. So you kind of, you'll understand that aspect. And then if you want to go into sports dietetics, you have to do an additional qualification. So hence, I mean, that's kind of what I did. But I think having that clinical and sports background is really critical to be a good practitioner. There are no jobs in the NHS for a sports dietitian, which is what makes this, I mean, I'd love there to be, but there aren't, sadly. And so unfortunately, the dietitians that are working in the NHS, unless they have their own interest and are maybe studying and are in potentially in a job that, you know, means that they can use that information, that there'll be very few of them. And what I find is, similarly, on the flip side of that, in private practice, when you're working with sports nutritionists, that's also another problem, because sports nutritionists don't have that clinical background. And so when it comes to the more restrictive and eating disorder RED-S, they don't know how to work with these individuals because they don't have that clinical background or training to really truly understand it. So it is something that I feel really passionately about. And in fact, I did do a talk last week to several dietitians that work within the NHS in eating disorders to help them to understand RED-S and where it fits, in the same way as I've kind of tried to explain to you all today, where it fits and how potentially you could respond to it. But I think sadly we're a bit far off everyone receiving that training.
Yeah, well, I agree. I think you're quite right. It's a tricky one, isn't it? And I find, I find myself giving short sound bites of information that I've gathered from reading papers and things like that, that I hope is something for them to go on. But of course, that can never replace the experience of a trained dietitian who has an interest in the area. But, there we are. So,
I mean, in an interim,
yes.
actually there's a lot of information in my latest book, More Fuel You, which could help an athlete. And I have lots of athletes that have said, this book has been great because they can't access me because they can't afford me. And, that's the problem, as we but all know, private practices. I mean, like I said, it's not where my heart is, but it's where I have to be to do the work I want to do, to pay my bills. And I wish there was an NHS opportunity because I'd love to take it on.
Yes.
But I think that there's a lot of information in my book, but it's also, like I said, my Instagram account is purely educational. So again, I put huge amounts of information on there. So for people who might want to help themselves a little bit, there's a lot on there that could be useful. And again, a lot of individuals will come to me saying, thank you so much for putting this content out there. We can't afford you, we can't access you, but this is really helpful. So hopefully that, I mean, it's not brilliant, but it's,
I think that's wonderful.
something.
I think something like that could be really invaluable, because I do signpost patients to the Train Brave website. I signpost them to Nikki Kay's website, which gives a lot of very scientific information, but actually for patients who are very interested, who want to learn a bit more, that's also very useful. So having something like an Instagram account, because it's free to access, I think would be very useful. So thank you. If you share the handle with us, I'm sure many of us will direct patients to it. Thank you.
The handle's on the last page of the presentation, so you'll get the presentation so you guys can have all that as well.
Perfect. Thank you so much.
No worries.
Thank you. Okay, so we had a burning question, I think, from Sonia as well.
No, Renee, you've already covered it. Sorry.
Already covered? You sure?
Yeah.
Okay, I had another one here, which is how would you start to approach then the unintentional underfueling athlete? Could you give just an example of how you might go about that?
Yeah, I mean, again, it's similar sort of obviously process of kind of understanding what they're fueling, when they're fueling, how much training they're doing, and then trying to see, often like the most common one I see is the fasted training. They're doing it every single morning because it's just easy, and they're worried about their like having enough energy, eating, having enough time. They'd rather have an extra few hours in bed. Who can blame them? But that's often the commonest I see. The other one I see is when potentially I suppose social media is infiltrating into them and they think they shouldn't be eating carbs, or they're using vegetables a lot as their carbs. So instead of having potatoes, they'll have carrots, for example. That's a big thing that I see quite a lot. So it's looking at the kind of discrepancy between how much energy they're utilizing and how much they're taking on, and particularly around the timing. Again, another common one is just not recovering sufficiently, not taking that that sort of flavored milk or that recovery drink with them to training to have. So something to be as simple as that is like just getting them to make sure they've got fuel in their kit bag that they can have as soon as they finish their training, even on their way to home or lectures or whatever it is that they're going to. So from the unintentional, it is very, and education, actually, if you're cycling to the pool, that still uses energy. You're going to have to think about that, just that kind of general information. And like I said, because these individuals don't have that psychological element to it, they're often really keen to make the changes you give them. So it's usually like still kind of goal orientated in terms of, let's start with this, let's see where you get to, then start with this and see where you get to. But usually they're quite happy and appreciate where their gaps are and be very happy to put that into place.
Okay, so just to sort of wrap up a little bit, whereabouts is your clinic that you see people?
So we see people online, so we can obviously do remote, so you can refer in from anywhere, but we do have a face-to-face clinic in Bath. So I do see athletes if they want to come in, and I don't mind if they do or they don't. Obviously, I think it's nice if you can, but if, you know, obviously appreciate if they're coming from Ireland or Scotland, that's quite a long way. So we have a clinic in Bath. The best way to refer any athletes you might want to, especially this group here, is probably to actually use the hello@reneemcgregor.com email that's on the presentation, because as I said as I was saying earlier, we'd actually like to encourage perhaps a kind of a partnership aspect to this group, in terms of being able to offer your athletes a little bit of a discount to what we'd normally charge. So if you are interested and you're keen for them to be seen, then please do send them our way.
Okay, great. Right, well, I think that's been a fantastic webinar. Thank you so much, Renee. Yeah, every time I've heard you speak, whether it's been at the running show or this evening, you know, it's really engaging and lots of great information there. Okay, so I'm just going to put up the my screen again, which has the QR code on it. Okay, so if you could complete feedback forms for us this evening, that'd be really great for our Out of the Blocks group. The group that supports the new consultants in their first 5 years post CCT or CSER. If you're unaware of the group, then you can head to the faculty page and search for Out of the Blocks, and it'll pop up our webpage, and it gives you good information about our peer-to-peer support that we offer, the mentorship scheme, and also the education side of things, and particularly in the feedback forms. Apart from saying how great this evening has been, if you could also put some ideas and pointers for us in terms of future webinars that you may want to see. Okay, thank you very much, everyone. And I'll just let you all leave, and Renee and Sonia, if you could certainly stay on, that'd be great.
Sure.
Thank
No
you.
worries.